So good afternoon, everyone. My name is Marissa Moncada from the New England QIN-QIO, and I will be your moderator for today's webinar, Medicare's Annual Wellness Visit, a Framework for Quality Patient Care. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation. If you haven't downloaded the slides, I've put a link in the chat where you can find the presentation. Throughout the presentation, you can enter any questions in the chat box in the bottom right corner of your screen. Please make sure to send these questions to all participants. We will take questions over the phone at the end of the presentation, and I will provide you instructions on how to do it at that time. So I will now pass this over to Susan and Jill to get us started.
Great, thank you. So good morning. Thank you for taking time out of your busy schedules to talk to us about Medicare's annual wellness visit. My name is Susan Richardson. I'm joined today by my colleague Jill McKenzie, and we're presenting today from the beautiful state of Vermont. So just a disclaimer, we did put together this presentation using up-to-date information. However, CMS can and does make program and regulation changes, so you always want to go straight to the source after today to make sure that you're using the most up-to-date information. So our objectives today are to tell you a little bit more about what annual wellness visits are, as well as what they aren't, differentiate the annual wellness visit from this IPPE visit, which is initial preventive physical exam. We're going to show you how annual wellness visits really provide the framework for you to address your patient's age-related and other issues, and this can actually result in improving the population health of your entire practice panel, all while providing a consistent revenue stream for your practice. And lastly, we're going to show you how the annual wellness visits can be applied to the quality payment program reporting requirements. So let's look at the differences between the different types of physical exams. Our presentation today will focus on the annual wellness visit. However, do know that the IPPE, or the initial preventive physical examination, is also a reimbursable visit from Medicare. That visit is also known as the Welcome to Medicare visit. It's covered only once within 12 months of the patient enrolling in Medicare. We don't pay a thing for this visit, so there's no copay or deductible for the patient. And the purpose of this visit is basically to detect diseases and prevent them and just promote overall health. Then we have the annual wellness visit, which is our focus, and that's covered once every 12 months, once the patient is beyond 12 months of Medicare enrollment. Again, the patient pays nothing for this visit. It doesn't require a specific diagnosis. And some of the hallmarks of the annual wellness visit is the performance of a health risk assessment with the patient and the development of a personalized prevention plan. On the right, you'll see just a routine physical examination. We bring this up because, the typical physical exam that doesn't have any relationship to any diagnosis or problem or complaint, that type of exam is not covered by Medicare. And if you perform those on your Medicare patients, they would pay 100% out of pocket for that visit. So just show you sort of the timing of different visits that we're talking about. We have that Welcome to Medicare visit, IPPE, which patients are eligible for once they enroll in Medicare, and then 12 months beyond. Then they would be getting an initial annual wellness visit, and that happens at least 12 months after enrollment or once they've got that IPPE exam, if they did have it. Then after that, you have the subsequent annual wellness visits, which happen at least 12 months after the last annual wellness visit. So as I mentioned, we're going to focus today on the annual wellness visit. So we're not going to go into the requirements for that IPPE visit. We do suggest that if you are going to institute an annual wellness program into your practice, that you probably should include that visit as part of your program because it is reimbursable. So that's why we included this link here that goes into detail the required components of that visit. So you have that for reference. So why all this emphasis on the annual wellness visit? First of all, it's really an excellent opportunity for you as clinicians to focus on the concerns important to your older patients and the time to consider issues often overlooked in a typical physical exam or an acute visit. It really provides a framework to comprehensively assess and address your patient's health and safety risks while providing those preventive services like influenza and pneumonia vaccines. Education, counseling, and care coordination also are emphasized, which can help your patients stay healthier, have fewer complications, and require fewer hospitalizations. So not only are your patients healthier, but there's also the added benefit of a consistent revenue stream and likelihood of improved quality payment scores, if you're doing MIPS track or you're in an alternative payment model. So CMS is really incentivizing practices to do annual wellness visits, and not only for these benefits that I just mentioned, but to help decrease costs. In 2017, CMS says that we spent $3.5 trillion, that's $1 trillion on healthcare, and about 30% of that is estimated to be related to overutilization of services. So if you have the annual wellness visit, you know you're going to be doing health screenings and other preventive services, as well as hopefully identifying earlier those patients with chronic conditions or multiple comorbidities. And the thought is that you can decrease utilization because you're identifying and addressing those issues before big problems occur. So there are many benefits to the annual wellness visit. For the patient, like I mentioned, there's no copay, so it's free to them. It encourages a strengthened relationship with you as their healthcare provider. And I've actually seen this firsthand with my mother. Her doctor's office does do annual wellness visits, and I've just seen over the last couple of years that she provides us a bit more information each time she has one of these visits, and I get the sense that she feels really supported and nurtured because he's asking about things that he might not ask in an acute visit. He has more time to spend with her through the framework of this visit. And as a result, you might be able to prevent some accidents that your patients might have at home. And again, my mother is a perfect example of this. She doesn't walk very well. She lives in a big house with lots of stairs, and despite my brother and I's attempt to get her to get a stair lift in her house, she was resistant until her doctor, as part of the annual wellness visit, discovered that her house is a bit of a challenge for her, the stairs. And he mentioned the stair lift, and it wasn't really until he encouraged her to do that she put in a stair lift. So I think it really did help her to prevent some accidents there, which hopefully will keep the patients out of the hospital and potentially delay the need for long-term care, reduce the risk of chronic disease, and hopefully just helping patients live a longer and happier, healthier life. You'll notice at the bottom of this slide there's a link to a patient flyer that was created by the American Academy of Family Physicians. And we include this here because if you do decide to institute an annual wellness visit program in your practice, it's important to educate your patients as to what it is. What the wellness visit entails, what they can expect, what to bring with them, and what it's not, and make that distinction between a physical exam. Otherwise, you might have the situation where, say, your patient's in Medicare Advantage and the insurer is sending reminders to the patient to go get their annual wellness visit, but the patient might not quite understand that it's a wellness visit and not a physical exam. So they call the office asking for a physical exam, which the scheduler schedules, but then they have to pay for that. So you just want to make sure that your patients understand the difference. So there's also benefits to U.S. clinicians and the practice in general from doing these annual wellness visits on your patients. It's really a focused opportunity to be able to complete medical history for your chronically ill as well as your older patients. There's a couple benefits to this. Obviously, you can better manage your patient's health. But also, as we move further and further into healthcare payment reform, there's risk coding associated and can be linked to how much reimbursement you get through the payment reform. So you need to have a complete picture of your patient's conditions in order to code appropriately and get the reimbursement that you deserve for taking care of sicker patients. Also, the annual wellness visits really strengthen the partnership between you and your patient, like I described with my mother. And a stronger patient-physician relationship has been associated with improved outcomes because, doctors are able to establish patient plans and routinely follow up with those patients. This can create more loyalty by the patient to you and your practice. And also, it can increase patient engagement because there's this personalized prevention plan that you will be creating with the patient. And it really asks them to get more involved with their care. It's also just an opportunity to proactively care for your patients. And I'm sure you all do this to a certain level already, but the annual wellness visit just really gives you that structured time and payment for having these proactive discussions with your patients. And then there's the benefit of it can increase your performance on quality metrics. Many of the required components of the annual wellness visit tie directly to quality payment programs, quality measures, and improvement activities. Practices that do have an annual wellness visit program, they tend to do better on those metrics. And then last but not least, annual wellness visits can create a new and sustainable revenue stream for your practices. So here's an example of the revenue opportunities you can gain through annual wellness visits. The figures listed here are from the 2019 Medicare physician fee schedule. Keep in mind that this may vary depending on your geographic location. So you want to check with your local Medicare administrative contractor, MAC, to find out your rates. But the point that I want to illustrate here is that the IPPE visit, that Welcome to Medicare visit, as well as the initial and subsequent annual wellness visits are billable. And it can add up to significant revenue for your practice. In the example here, we have 200 total attributed beneficiaries. If you're bringing them in each year for an annual wellness visit, that can be over $23,000 coming into your practice. So there, you can also bill for advanced care planning if you do it as part of an annual wellness visit. It is not a required element of the annual wellness visit, so it's something that you have to decide on a case-by-case basis. Is this something your patient wants and needs? Where you're having a discussion with them about advanced care planning. So the first 30 minutes are billable as our subsequent 30 minutes increments. So despite these benefits that I mentioned, wellness visits are underutilized. You'll see from the graph there that rates have gone up, but we're still seeing that fewer than 20% of Medicare patients receive annual wellness visits. And more than half of primary care practices offers no annual wellness visits to their patients. And only less than a quarter of practices provided annual wellness visits to at least 25% of their eligible patients. So certainly there is room for improvement, and we hope our talk today will compel you to really consider instituting this in your practice. And while it does take some time and energy to get the program going, those practices that we've talked to who have put in a program report to us that it really wasn't too difficult to put in place, and the return on investment is definitely worth it in terms of revenue to the practice as well as to strengthen relationships with your patients. Okay, so we've talked a little bit about this. This is kind of a recap of what an annual wellness visit entails, or includes the patients beyond 12 months of Medicare enrollment. This includes a personalized prevention plan of service. There's no copay or deductible. I do want to mention that an annual wellness visit does not require a specific diagnosis code. It does require an ICD-10 code, but you just choose the one that makes most sense for your patient. The annual wellness visit also does not include any lab tests. You certainly can make referrals for such tests as part of the annual wellness visit, but they're not included as part of that annual wellness visit. So the initial, here are the minimum or the components of the initial annual wellness visit. Subsequent wellness visits include the same components, but you're basically just going to update and review the information that you established at the initial wellness visit. And we'll go into detail about each one of these throughout this presentation. So one of the hallmarks of an annual wellness visit is this health risk assessment, which is basically a structured way to evaluate your patient's current health status, the presence of disease or risk of disease and disability, as well as safety risk at home and in the community. And it really just provides a structure to have a conversation with your patients about how they feel about their health, what's their health behaviors like, how they can take a more active role in managing their own health and well-being. So Medicare does not require you to use a specific health risk assessment form. As long as it includes these components, you would be okay. So you want to make sure your form includes collection of demographic data. You're going to ask the patient to assess their own health status. You want to look at the different risks they have, whether behavioral and psychosocial, as well as their ability to do ADLs and IADLs. One thing that you want to keep in mind is that is the health literacy of your population, and just English proficiency, when you are thinking about the health risk assessment, how you deliver it. It should not take more than 20 minutes to perform a health risk assessment. You can have your patient have it do it before or during the annual wellness visit, or you can do it together with them. It doesn't have to be long or complicated. It just needs to collect this basic information, which you'll use as a springboard for conversations with them. The other thing I want to mention about the annual wellness visit is that it can be performed by many different types of medical professionals. Obviously, an MD/DO can do the visit, as can advanced practice professionals, such as NPs and PAs, certified nurse specialists. And you can also have health educators do it, registered dietitians or any other licensed practitioner. Or you can even have a team of medical professionals in your office do different parts of the annual wellness visit. As long as they're under direct supervision of a physician, that is no problem. So now I'm going to turn it over to Jill to finish out the presentation.
Okay, are you going to give me the ball or will you be advancing the slides?
I can advance for you.
Okay, and could I ask, somebody is not on mute when we're hearing some background music, or background sounds, I should say. So if you can put yourselves on mute. So welcome, everybody. So along with the health risk assessment, there are other minimum requirements of the annual wellness visit that must be satisfied. We're going to review all of these in the next few slides. These include establishing the beneficiary's medical and family history, past medical and surgical history, as well as use of medications and supplements. Also, you must establish a list of current providers and suppliers that regularly provide the patient's medical care. Next slide, please. The annual wellness visit should include assessing standard measurements such as height, weight, BMI, and blood pressure, as well as screening for cognitive function, reviewing the patient's potential risk for depression or other mood disorders, and reviewing these patients' functional ability and safety, including screening for fall risk, home safety, and hearing impairment. Next slide, please. Should also include establishing an appropriate written screening schedule for the patient, such as a checklist for the next 5 to 10 years that is based on the beneficiary's health risk assessment, health status, and screening history. Any risk factors and conditions for which interventions are recommended or underway should be reviewed as well. One of the advantages of the annual wellness visit is that it gives the provider time to furnish personalized health advice and provide appropriate referrals to health education or preventive counseling services, such as fall prevention, as Susan mentioned, nutrition, physical activity, tobacco use cessation, and weight loss. Next slide, please. You can also provide an advanced care planning services at the time of the annual wellness visit. However, you must note that this is optional and it is at the patient's discretion. Advanced care planning services is the face-to-face conversation between a physician or another qualified healthcare professional and a patient to discuss the patient's wishes and preferences for medical treatment if they are unable to speak or make decisions in the future. And note, this can be billed, however, it has to be done during the annual wellness visit. Next slide, please. Now we're going to focus on how the annual wellness visit improves the health of your patient, panel, and reduces healthcare costs. As you're aware, patients who receive coordinated care often stay healthier, have fewer complications, and require fewer hospitalizations. The annual Medicare wellness visit can help provide better care and care coordination to the patient aimed at community-based lifestyle interventions to reduce health risks and promote self-management and wellness, including diabetes, nutrition, physical activity, tobacco use cessation, and weight loss. Next slide, please. So these healthcare screenings that are performed during the annual wellness visit can be really beneficial to a patient's health and well-being. As you know, hypertension remains a really important public health challenge in the United States. It is the costliest of all cardiovascular diseases, costing the nation over $48 billion each year. 75 Americans have hypertension and only half have it under control. 1 out of 5 U.S. adults has hypertension but doesn't even know that they have it. So screening for hypertension and identifying common risk factors can be the first line of defense against the silent killer. Next slide, please. Excuse me. Screening for tobacco use and providing cessation information will lead to a healthier lifestyle for your patients as well. Make sure that you document that you screen for tobacco use, not just smoking, and that you provide the cessation information to the patient. Next slide, please. Proper management is critical to detect the onset of diabetes and manage the progression of the disease. Research suggests that 1 out of 3 adults has prediabetes. Of this group, 9 out of 10 don't know they have it. Approximately 25% of Americans over the age of 60 have diabetes. Implementation of diabetes screening during the annual wellness visit will identify patients at risk for diabetes and provide an opportunity to address this risk. Next slide. At the annual wellness visit, a review of your patient's medications should be completed as well. Medication reconciliation can improve communication and reduce medication errors. It's very helpful to ask your patient to brown bag it. Put all the medications, including supplements, vitamins, anything they're taking, in a brown paper bag and bring it into the office so you can see firsthand what they're taking. We encourage providers to pay close attention to opioid use during this part of the annual wellness visit. If a patient is using opioids, assess the benefit for other non-opioid pain therapies instead, even if the patient doesn't have an opioid use disorder, but is possibly at risk. Next slide. According to the World Health Organization, depression is both underdiagnosed and undertreated in primary care settings. Depression occurs in 7% of the general older population. Undiagnosed depression leads to higher health care costs due to complications of chronic disease or increased hospital stays. For example, a diabetic patient may have higher glucose levels, or a patient with arthritis may experience more pain than usual. Implementation of depression screening during the annual wellness visit will identify patients at risk for depression and provide an opportunity to address this risk. Next slide, please. Using an annual wellness visit to screen for alcohol use is also beneficial to the patient's health and well-being. This screening is often overlooked in seniors, even though they are especially vulnerable to the consequences. Older adults are more likely to have chronic health conditions and take prescription medication, which may further complicate adverse effects of substance abuse. Heavy drinking may exacerbate chronic conditions such as diabetes, hypertension, and depression. Next slide, please. As Susan well illustrated, screening for falls is another beneficial screening done at the annual wellness visit. In 2016, it was estimated that every day over 5,760 older adults were treated in the emergency room for injuries related to falls, and the nation's expenditure was $30 billion a year treating older adults for injuries related to falls. Fall prevention education increases knowledge about avoiding falls and encourages older adults to stay active. As Susan said, when the physician brings up risk for falls, the older person actually listens instead of a family member. So implementation of fall screening during the annual wellness visit will identify these patients at risk for falls, and it provides an opportunity to address this risk. Next page, please. The annual wellness visit provides a perfect opportunity to discuss the benefits of influenza and pneumonia vaccinations. A healthcare provider's recommendation strongly influences whether a patient decides to become vaccinated. In 2015, a study indicated that the seasonal flu vaccination rate was 64% among those with an annual wellness visit and only 44% among those without. More than 33% of patients who had an annual wellness visit in 2015 received a PCV13 vaccination in that same year compared to 14% of those who did not. Older adults have greater susceptibility to and complications from disease, and so they stand to benefit greatly from vaccinations as a preventive health measure. Next slide, please. So we have just illustrated the annual wellness visit can improve your patient's health through disease prevention, early detection, and lifestyle modifications that support a healthier life. It can also help you succeed in Medicare's quality payment program, as several quality measures directly correlate to some of the elements of the annual wellness visit, including the ones listed here. With each annual wellness visit performed, some of these quality measures may be addressed, and as long as they are properly documented in the medical record, this data can be used for the quality category in the quality payment program. Next slide, please. The annual wellness visit also assists providers in fulfilling the requirements for the improvement activity category of the quality payment program, including the ones listed here. Next slide. Bill Gates hit the nail right on the head when he said treatment without prevention is simply unsustainable. The annual wellness visit provides an opportunity for providers and their patients to achieve the goal of preventing onset of disease and disability by slowing existing illnesses through health promotion and disease detection. Next slide, please. This is a nice picture down the street from where I live in Vermont. And now, as you're looking at that beautiful picture, we'll open it up for questions.
Thank you, everyone. At this time, we will take some questions. If you would like to ask a question over the phone, please press #6, or you can pose your question in the chat box. And Jill and Susan, we do have quite a few questions already, so I'll go ahead and start. So we have a question. It was my understanding that you can bill for advanced care planning multiple times and does not need to be attached to any particular visit. Has this changed?
So this is Susan. It is my understanding as well that it does not have to be attached to a particular visit. Our point today was just to say that you can include it as a component of the annual wellness visit, but you don't have to.
Great. Another question. Can we order diabetes testing labs under the annual wellness visit, and will they be covered as long as appropriate?
I believe if you can order lab tests, but there may be a copay to your patient. So you
and
have
there
to
was
let
a
them know.
second piece to that question that I missed, and our ICD-10 codes included.
I'm not sure if I understand that question.
If you're asking that if you have to have the codes submitted along with it, the answer is yes. If you're trying to bill for some of those additional preventive services or other services, you can do them as part of the annual wellness visit, but you need to make sure that your documentation is there, and there'll be the usual co-pays and co-insurance and deductibles that the patient would pay outside of the wellness visit.
Another question. According to CMS guidelines, we have to attach a modifier of 33 on ACP, yet on another CMS site, I find that Medicare does not recognize modifier 33 or MIPS.
If you look at the ABCs, it's an MLM document. It's the ABCs of the annual wellness visit. It does say that Medicare waives both the coinsurance in Medicare Part B deductible for ACP when it is billed with modifier 33.
Another question, can an RN perform both the annual wellness visit and the ACP? My understanding was that an RN can't perform the ACP.
Well, when they list all the different medical professions, this has been asked several times. They say healthcare professionals, and I've heard both that they can and they can't. So I would contact your MAC just to make sure, see what they say, your Medicare contractor.
Can a pharmacist perform these visits? I have read that a pharmacist may complete these visits.
I believe
they are licensed health professionals, yes.
Yes, I don't believe they can do the initial, but I believe they can do the annual wellness and the subsequent.
Why is reimbursement higher for the initial annual wellness than the ITP?
The initial exam is a little bit more expensive in that you are doing the initial health risk assessment and the personalized prevention plan. So that takes a bit more time than just reviewing and updating the information. So that's why it reimburses a bit higher.
If a finger stick is done at the annual wellness visit, can we charge extra for that?
I'm sorry, I don't have the answer for that, but we can get the answer if you can put your email in the chat and get back to you.
There are young patient panels in ACO, and do they need an annual wellness also?
No, remember that the annual wellness visit is only for Medicare patients. So if they are Medicare, enrolled in Medicare Part B, they would potentially be eligible for it, but otherwise, no. It's really geared for the older folks. Yeah.
How best to implement the annual wellness visits with nurses, including LPN?
Well, that really depends on the structure of your practice. I think the basic, you need to determine, maybe start small, figure out how many Medicare Part B eligible patients you have. Choose your health risk assessment and consider the needs of, the eligible patients, and, think about logistically what you would need to put it in, or implement it. It makes sense to leverage your electronic health record if you have one, to put in reminders, to do the different screenings that are required. So it's, there's no standard answer. It really depends on the workflow of your practice and how many patients you're talking about and so forth.
Does Medicare cover dietitian, nutritionist counseling with qualifying diagnosis?
I would think yes, but that's another one that we should look into further. I think if you have the appropriate CPT codes, the usual co-insurance, co-payments, and the deductibles would apply, but I think you could leave those in as part of the wellness visit if you wanted to and documented it properly. Do you agree with that, Jill?
Yes, I do.
Our EMR asked about depression in the annual wellness visit, but it seems that quality measure requires a specific test or survey. Which do you suggest?
With the annual wellness visit, there's several different ones that you can use. They don't have a specific one that you have to use.
So you want to pick a standardized tool. I mean, it could be as simple as the PHQ-2, or the PHQ-9, whatever you deem appropriate, and will work with your workflow.
You mentioned advanced care planning. Are you aware of any good templates for clinician use, topics and resources to cover to meet that requirement for the add-on?
I would suggest that you look up the MLN ABCs of the annual wellness visit. There are several links to different tools that you can use, and then just find which one's the best fit for you.
If we bill for tobacco cessation and advanced care directives, would that be an additional fee beyond the annual wellness visit fee?
I'm not sure if you can bill separately because it is part of the preventive service. We'd have to look into that as well.
Yeah, my sense is that the answer would be no, but we're not billing experts, so we're guessing on that one a little bit. But we can look into it.
Can an SQHC bill advanced care management with the annual wellness visit?
I believe they can. They have different codes that they would use for the annual wellness visit in ACP.
Are we screening for the need for preventative vaccinations, or can we bill for them in the advanced annual wellness visit?
Again, as we're not billing experts, we'd have to look that up again and get back to you.
That's a good question. My sense is that vaccination would be included, but we would need to confirm that.
How do we receive credit for the fall risk screening
Do you mean credit in the quality payment program, or as long as it's documented sufficiently in the medical record? You can use it as one of the for the quality payment program.
Another question, the IPPE is less than the annual wellness visit in your first slide.
Yes. And that's because it's not an annual wellness visit. It's a different type of visit. It's similar, but it doesn't include that health risk assessment piece, as well as the more in-depth personalized prevention plan. So it does reimburse a little bit less. I don't really know how Medicare came up with the amount, but it's not quite of an intense of a visit.
That makes sense. How would we proceed if a patient were to come in for an annual wellness visit, but they have multiple complaints?
Well, generally, you can provide other medically necessary services on the same date as annual wellness visit. The deductible and co-insurance or co-payment apply for these other medically necessary services. So, as Susan had mentioned earlier, you really want to communicate this with your patient. Let them know that they're there for the annual wellness visit. However, if something else comes up or other labs are ordered, that they will have to pay the co-insurance or co-payment and deductible.
Can you do an annual wellness visit without having an initial welcome to Medicare? Patient may not know if they had an initial visit.
Well, their very first visit, that's after 12 months of their enrollment, would be considered the initial wellness visit period. So if it's any time, if it's their very first visit after that IPPE visit, it would be considered an initial annual wellness visit. There are ways to check their eligibility for the different visits. And it escapes me right now the name of where you look to check. We can get that for you.
Yeah, actually, excuse me, Susan, I have that right in front of me. You may access the information through the Health Insurance Portability and Accountability Act, Eligibility Transaction System, the HETS, or through the Provider Call Center Interactive Voice Responses. And they also suggest that the providers check with a Medicare administrative contractor for options available to verify beneficiary eligibility.
Okay. Do you have to have Medicare Part B to have an annual wellness visit?
Yes. At least if you want it to be reimbursed.
Our EMR asked about depression in the annual wellness visit, but it seems, I already read that one. Let me skip down. If a person has never received the Welcome to Medicare visit, would this be the initial visit we are talking about? And then a year later, the pharmacist can perform the annual wellness visit and bill the first code. Just looking for some clarification. And the code is GO438.
So if the patient did not get an IPPE visit, just to clarify, that IPPE visit is a one-time, lifetime visit, and the only window which they can get that visit is upon Medicare enrollment and through 12 months after enrollment. Once that time window has ended, then we're only talking about annual wellness visits. And the first annual wellness visit would be the initial, and then anything after that would be the subsequent.
Right. And Medicare pays for only one first annual wellness visit per beneficiary for lifetime, and then one subsequent annual wellness visit per year thereafter.
Correct.
Can we give the pneumonia vaccine and influenza during the annual wellness visit, or would the patient receive a charge for those?
I believe they would receive a charge for that.
And last question, are there recommended annual wellness visit forms that we can have patients fill out prior to their visit?
Yes, there's once again, if you go into CMS.gov and just look up annual wellness visits, they have all kinds of tools there, and the MLN ABCs to the annual wellness visit has all different types of tools for the health risk assessment, depression screening, all the diabetes screening, all the other screenings that you can do. So I highly suggest that you look that up.
And all those references are included at the end of this presentation. We have 2 pages of links to references for you.
And another question just came in. If a provider performs a physical exam, can it still be billed as an annual wellness visit?
No.
No.
No, it's not reimbursable. You need to make sure that you have all the components of the annual wellness visit to bill for an annual wellness visit, and physical exam does not count.
Right, and Medicare does not cover routine physical examinations.
We do have a few minutes left. If you'd like to ask a question over the phone, please press #6, or you can enter it into the chat box. In the meantime, I'll just have some last few announcements. A reminder that we are now on social media. Visit us on Facebook, LinkedIn, Twitter, and YouTube. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would greatly appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing a computer, you'll receive an email tomorrow with the link to the evaluation, as well as the link to the event page on our website. The PowerPoint presentation is posted on the website. Within the next few business days, a recording and transcript of this webinar will also be added. I have posted the link in the chat again. So we have a few more questions coming in. As I mentioned, the recording will be available on the webpage in the next few business days, and I just entered that into the chat box. Another question, in summary, the IPPE and the annual wellness visit are actually screening, and I'm not understanding this question. I apologize. So don't include those co-payment items. If you'd like to clarify, you can press #6.
Hi, thank you. Hello?
Yeah.
Hi, so actually, this is Pat. I actually asked a question. So I was just wondering, it sounds like for the IPPE visit and for the first initial wellness visit that there is a caution suggested that it needs to be used as screening and care plan and planning sessions, and not to actually include anything that the patient may potentially be billed for, such as vaccines or other things. Am I understanding the gist of that?
Yeah, the annual wellness visit doesn't include any clinical laboratory tests, but you can make appropriate referrals for these tests as part of the visit. But again, you just have to communicate to the patient that they may be billed for this.
Another question, we were denied for annual wellness visit for a home visit. Why can it not be done in the home?
I honestly do not have an answer for that. Susan, do you?
I don't. That's a good question.
That's a very good question.
It should allow it, yeah. In fact, you get a better sense of the risk that they have in their home, but
What if all other components of the annual wellness visit are performed and the provider does some elements of an exam?
I'm not understanding the question. I'm sorry. Could you clarify that?
You can unmute yourself by pressing pound 6. All right, and last question. Can we do 2 exams, initial and subsequent exams?
At the same time? At the same visit? No. If that's what you mean. No, they have to be 12 months apart.
So they just clarified no year apart.
So if they're not a year apart, then no, you cannot bill for both. It has to be at least 12 months apart.
So we'll stay on the line just a few more minutes. If you have any more questions for the presenters, you have their information on the slide now. But other than that, thank you for attending, and we'll just stay on the line for a few more minutes.
If the patient there for the first consultation, $55 today. Yeah, I do a Medicare initial visit. Yeah, so that is just a whole exam. Yeah.
So another question just came in. If a patient is unable to complete the page Q9, how would you evaluate depression?
G0438, the first one.
Again, there's all different screening tools that they could use. If they're not able to complete that, I would suggest either at the end of our presentation, looking into the link or clicking on a link, or again, look at the ABCs of the annual wellness visit, and they'll provide different screening tools.
Okay, thank you everyone for attending. We're going to close out the line. Hope you have a great day.
Thank you very much.
Thank you.